That concludes our questions and answer on Ask the Doctor. I'm Dr. Weibel, and we'll see you next time.
Dr. Weibel, you're known as one of the pioneers in the treatment of scars, especially burn scars, by applying today's latest cutaneous laser technologies. One of the common questions I get in my practice all the time after somebody gets a tummy tuck or other surgical procedures, what can I do to make my scars go away? And any good techniques out there to help these patients?
We have some great techniques. Anytime you go to a plastic surgeon, you're creating a scar, and what we found are that lasers are really the gold standard for treating scars. And we like to treat scars as soon as possible. We can take out the red, we can improve the texture and camouflage them. We can't make them perfect, but almost perfect.
Great. And you're saying the best time for them to see you is early post-operative, or once they're done with me? When's the best time to get them to you?
We work closely with our surgeons. As soon as you feel that their surgery has gone well and there's no complications and there's epithelium, that's the top layer of skin, is intact, so no ulcers, nothing oozing, we can put a laser on it right away. And the sooner you get to a scar, you can actually prevent a scar from forming. Because most scars get worse in the initial period. Mm-hmm. You know, for a surgical scar, that's usually in the first month. For a burn or traumatic scar, they can get worse from 3 to 9 months. And we have found that with lasers, not only can you fix an old scar, but you can prevent a new scar.
Is there any point in time where it's too late to treat a scar?
Never. Any scar is good for laser treatment, which has been exciting.
That's great.
Yeah, and whether they're red, they're brown, they're too depressed, they're too elevated, the laser's like turning off your computer and resetting it. It takes it back to kind of normal skin.
That's great.
Dr. Weibel, one of the things that I see is there's tons of patients that come in with burn scars, and whether they're acute burn scars or later on, and you being an expert here, can you fill us in on what we can do for them? I know from a plastic surgery perspective, a lot of them have been treated with big reconstructive surgeries where they're in the hospital for an extended period of time, or multiple stage procedures, which is very cumbersome and difficult for patients.
Yeah, well, thanks to the surgeons, the acute trauma surgeons and the burn surgeons, we have a 98% survival for both civilian as well as military patients. So we're starting to see a lot bigger scars in our office because we have a lot more survival. So it's up to us as physicians to help our patients. Mm-hmm. And truthfully, we can improve scars 60 to 80% with a series of treatments. Now, we partner closely with the surgeons. It's a team approach and multi-specialties that get involved. But we have found that by lasering them before you go to surgery, we can make the scars softer. Or if they've had surgery and surgery has done the best it can, then the lasers tackle texture, color to improve the scar and make it more skin-like.
So, Dr. Weibel, burn scars can be very scary. Is there a certain period of time where you can start with a burn scar that's different from a surgical scar? Because I know that sometimes patients are really worried about them.
Yeah, well, we've been treating them for 10 years and over 50,000 burn scars. And at first, we had waited about a year because that's what our reconstructive surgeons were telling us, you know, don't touch the burn. But it was a patient, I had a call from a New York family, and they had a 2-year-old little girl that had had a water burn. And she called and said, can you help my daughter? And I said, well, it's only 2 or 3 months into the injury, come back in a year. And she said, I'm getting on a plane and flying to Miami, and she did. And I have 3 daughters and a son, but she showed up in my office and said, you've got to help my daughter. And we did, and we lasered her at 3 months, and you always wonder, but her scar virtually vanished. And so, if it wasn't for that patient, who will be joining us later on the show, that was really my motivation, and we treated her, and you can see her scar has almost disappeared. And so over the last year and a half, we've been treating over 200 scars as soon as the skin is reepithelialized, as soon as 3 months, and we're doing a clinical trial right now to kind of scientifically prove that point.
That's really innovative because I know as a plastic surgeon, the classic teaching is to wait a year, let the scars mature, and do a lot of hand-holding for a year. And the classic mantra that I was taught, and I'm sure you all were taught as, in your training, is don't do anything for the first year.
Well, and part of that's because we have these new fractional lasers, and they've really been revolutionary. They create these tiny wounds that the body can heal very quickly. And so now what we see is you can prevent a scar that from getting hypertrophic or elevated if you get there within the first 3 to 4 months.
So for patients who might have a scar, whether it's a burn scar or a surgical scar, what type of investment of time should they expect? Can you promise that it'll take 5 sessions, 10 sessions, 20 sessions?
It's a great question. So I tell all my patients, each time you treat, it gets better and better. So you know, if you want to get 10% improvement or 30% improvement or 80% improvement, most patients for scars need between 3 and 5 treatments. We have several cases that are 7 to 10 treatments. I don't think I've ever treated a patient more than 10 times. But a lot of our severe burn patients have had 50 surgeries, and this is in the office. It usually takes about an hour, outpatient procedure with about a week of wound healing with almost no social downtime. They can go back to work, they can work out. So patients really love the laser treatment of scars.
No question.
That concludes our questions and answer on Ask the Doctor. I'm Dr. Weibel, and we'll see you next time.